Recently, I got diagnosed with ADHD and was prescribed ADHD meds for the first time. But the fact that I'm diagnosed with ADHD doesn't make me feel much of anything. Because getting diagnosed with ADHD isn't like getting diagnosed with cancer, where you go to the doctor, present your symptoms, and the doctor finds out that the cause of those symptoms is cancer based on imaging and biological tests. And that news is news to you. It is shocking. You receive this news and you go like, holy shit, I have cancer. Oh, fuck. But with ADHD, it's different because conditions like ADHD, autism, anxiety, and depression, they aren't diagnosed using biological tests. A psychiatrist diagnoses you based on your self-reported symptoms. So upon getting diagnosed with ADHD, I didn't react like, oh shit, I have ADHD. No, I felt literally nothing because it just confirmed the suspicion that I already had. The psychiatrist confirms, yes, indeed, you have the symptoms that you say you do. Because the criteria for ADHD is these symptoms. Another difference between getting diagnosed with something like cancer and getting diagnosed with ADHD is when you go and get checked out for your symptoms, you hope that you don't get diagnosed with cancer. You're like, fingers crossed, this better not be cancer, this better be something that's not that bad. That's what you're hoping for. But with ADHD, when I go in, I'm hoping that I do get diagnosed with ADHD. Not getting diagnosed with the condition would actually be a disappointment because that means that I don't get to use medication to help me deal with my symptoms. Now, before I got diagnosed with ADHD, I was like 90% confident that I had ADHD. But after I left the virtual psychiatrist appointment, I started to feel some doubt. I started to think, maybe I don't have ADHD. This diagnosis isn't as confirming as I hoped it would be because I got diagnosed and prescribed stimulant medication in a 1-hour virtual telehealth visit. So I wondered, with the limited amount of information that I was able to communicate to my psychiatrist during this time, can she really be sure that I have ADHD and that my symptoms aren't caused by other possible causes? The psychiatrist did ask about my history to rule out potential confounding factors such as trauma from abuse, depression, and anxiety, things like that, which can cause some of the similar symptoms to ADHD. But coming out of the appointment with the Vyvanse prescription, I was like, did we dig deep enough? Is this enough to be really sure? I feel like this quote-unquote official diagnosis is not any stronger of a confirmation that I have ADHD than my own self-diagnosis. Of course, the doctor knows more about ADHD than I do, but from that 1-hour visit, does she know that I have ADHD better than I do? I'm not too sure she does. She made her assessment based on the information I provided to her in 1 hour. I came to the conclusion that I probably have ADHD from so much memories, emotions that don't fit into a 1-hour time window. So that gets me thinking, other than the ability to get accommodations and medications and other forms of healthcare for ADHD, is the diagnosis any better than a well-informed self-diagnosis? Does a medical professional saying that you have ADHD hold more weight on a certainty basis than you coming to the conclusion that you have ADHD? Because the medical professional has more knowledge and has years of clinical experience treating people with ADHD, but you have a lot more exposure to your own symptoms and your experiences. So what do you guys think about self-diagnosis? Is it legit? Should it be discouraged? Discuss in the comments.